Welcome to State of Reform's virtual series, 5 Slides We're Discussing, with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
Hello and welcome to another edition of 5 Slides We're Discussing here at State of Reform. We are super excited to have you, about 220 folks registered to be with us in this conversation about how the healthcare community in Hawaii is dealing with COVID. And we're going to get into, of course, how the community and the healthcare community specifically is dealing with this from a healthcare perspective, but also from an economy perspective. Before I introduce our panelists in this conversation today, I want to give you a little bit of a walkthrough about the logistics and our tools here in this conversation. And of course, I know folks will be joining us as I'm talking, so I'm a little bit of the warm-up act for the real talent in this show. But as you watch this, you'll see on the right-hand side of your screen a couple of tabs, a Q&A tab and a handout tab. On the Q&A tab, that's where we'll track the questions that you may have, and it's a great place for you to engage in conversation. When you have a question that you like, go ahead and write it there, and then other people will often share, of course, the same question. So you'll be able to upvote to be able to prioritize those questions that you think are most relevant and most engaging. As we move through the conversation, I'll take those and I will try to answer, or rather try to ask our panelists for them to address and speak directly to your questions. We do really want this to be as interactive as possible. We think that in this time of COVID, nobody wants to get in a room with another 300 or 400 people if they can help it, but we still have enduring challenges that we face, and we still have a need for community. So we're trying to do that with the tools of the virtual age. So go ahead and pose your questions, and we'll make sure we try to get those answered. Without further ado, I want to jump right into the introductions of our panelists and our conversation here today. We'll start with, and let me just introduce each of you individually, and then I'll give you an opportunity to talk about your organization here just one second. CEO and President of HMSA, Dr. Mark Mugiishi. Thank you, sir, for being with us. Why don't you, actually, let me do this. Let me introduce all three of you, and then I'll come back to you. Ray Vara, President and CEO of Hawaii Pacific Health, and Dr. Mary Boland, the Dean of the School of Nursing and Dental Hygiene at the University of Hawaii at Manoa. So thank you guys for putting up with that stilted introduction. Mark, let me ask you first, sir. Before we get into our slides, tell us about, this experience with COVID and how HMSA is thinking about it, how you're dealing with it, and what it's like to be a leader of one of the larger institutions in Hawaii during this public health crisis.
Yeah, thanks, DJ. Really appreciate the opportunity to be here with some other great panelists to talk about healthcare and how COVID-19 has affected healthcare in Hawaii. I think, working for a big health organization like HMSA is, we have the opportunity to go through what everybody else has gone through, which are the things like how to work from home, how to take large organizations and change the way you do business, how you hold meetings, how you do those kinds of things. And then we also have the unique ability to play in the healthcare space, where we talk about, can we deliver care in other ways that are unique to this pandemic situation, like more telehealth, more virtual care, things like that. And so, looking very much forward to discussing all of those transformations that we all had to make and what the next phase of recovery is going to look like for us.
Yeah. Thanks, Mark. Ray, tell us about how HPH is enduring this public health storm.
Yeah, thanks, DJ, and thanks for having me. I think many of the same things that Mark has described, we've experienced as an organization around having to transform the organization and how we interact with our community. But frankly, I think the COVID-19 experience has pushed the breadth of our mission to create a healthier Hawaii forward, in terms of recognizing that given our size and scale in the community, we have a responsibility that goes much broader than just the care that we can provide within our facilities, but recognizing that we have to be willing to provide leadership as an organization as it relates to the social determinants of health. And that has never been more true than when you have a public health crisis versus an economic crisis such as resulted with COVID-19. So we have found ourselves not only working on the public health issues for sure, but also working on how do we reactivate our community? How do we get involved in addressing affordability and food security, and how do we view the school systems into the future, and how do we address all those social issues that have come as a result of a rapid increase in unemployment in our state. And so I think given the way we viewed our mission, we were well poised to do that. But it certainly changes the way that we view the way we interact on a going forward basis exponentially faster than we had likely anticipated.
Yeah. It's a lot of stuff outside of the traditional scope of a hospital system, for sure.
For sure.
Mary, from where you sit, both in terms of public health and academia, but thinking about getting the economy restarted and contributing to the overall conversation in Hawaii, how would you sort of place this time within the context of other challenges, whether it be the hurricanes or other economic contractions in the state? How do you sort of put this time in context?
Well, the way I would think about it is that we're navigating uncharted waters, both as insurers, healthcare providers, but particularly as educators. Manoa is a commuter campus. Of the 10,000 plus students, 2,000 of them live on campus. In nursing and dental hygiene, we have about 400 or 500 students. So we had to pivot very, very quickly in the spring. And what we're now doing, I think, is looking at how do we keep up with what Mark and Ray are doing in their organizations, candidly. Academia has a reputation for moving slowly, but we're committed to being sure that our students get graduated, but not only that they're graduated realizing how quickly the system transformed, and then transforming our curriculums to meet it. The other hat that I wear is the background in public health that I got interested in a long time ago on the East Coast with another actually pandemic, and hoping to have some impact on how the state responds, because the economic recovery candidly is key. We have the tools, and I'll talk about them in my slide, but we have the tools to manage the pandemic, particularly in Hawaii. But at the same time, we have to be sure the economy restarts so people can afford to go to school, right? As well as we continue our vulnerable populations access to care, which is a secondary effect of the last few months where people stopped going for care. And then now we're seeing more complicated conditions when they do.
Yeah, the connection between public health, individual health, and certainly community health and economic health is really not just unquestioned, but I think coming into particularly sharp focus during this experience. I want to turn to our first slide. This is a slide among the 5 that I have brought to this conversation, and it's relatively simple. It's a screenshot of the unemployment rate in Hawaii as produced by the Federal Reserve. This is it shows in gray the other periods of economic contraction, and of course it's a little hard to see, but on the far right there's just a way out of context spike, record high now up into about 23% across the state and upwards of 60% in the neighboring islands. Ray, let me ask you to start this question. How do you, these numbers nationwide, but in Hawaii are just so staggering. It's hard to kind of put them in context. How do you try to make sense of numbers that are so strikingly high when it comes to unemployment and the state of the economy?
Well, I think this becomes the azimuth for the work that we have to do as a community and as organizations, both working in partnership with government as well as one another. We have framed this whole time into really 4 buckets or 4 phases. The first being public health, the next being what I would consider humanitarian / the need for rapid relief. The third, reopening the economy within Hawaii, and then 4th, opening ourselves up to travel and tourism. And the fundamental metric that will determine the success of our ability to provide that balance between meeting the needs of the public health and safety and impacting effectively, those other three phases is going to be a result in our unemployment numbers. During this time where we see such high levels of unemployment, I would argue that phase two is the most critical. This is when people are going to be struggling to keep food on the table. It's going to be when people are struggling to pay their rent and meet those most basic needs that families throughout Hawaii have. And so right now, as I look at where public health is at and the spread of the virus, I think this is the most critical metric that we have to determine how successful we are at dealing with those other issues as we reopen the community.
So Mark, in your capacity, both, as a leader in the healthcare community at HMSA, but also, in leading the effort to help reopen the economy or advise on how best to reopen the economy, what are you hearing from business leaders? What are you hearing from associations, from the employers who want to put people to work, but are trying to balance the health of their employees with, the need of getting the economy going again? What are you hearing from those folks?
Yeah, I think, everyone is trying to balance that. And I just want to call out that both Mary and Ray worked with me on the effort to come up with a recovery plan, a public health recovery plan that could safely help reopen our economy. And the reason why it's important for people in public health like Ray and like Mary and like myself to be involved in this is that they are one and the same conversation. Economic inadequacy and public health are one and the same conversation. I mean, obviously, COVID-19 is an astoundingly bad disease. It's something that we should pay attention to and take care of. But economic inadequacy is an astoundingly bad circumstance as well. And then if that prolongs for any period of time, the public health implications of that are, it's hard to recover from that. And so I think we need to do both things, right? We need to balance making sure that we take care of the short-term, we mitigate the short-term effects of a large infectious disease. And we also pay attention to making sure we get back on an economic path to make sure that we will have public health for the next generations of people who live here in Hawaii.
Yeah, Mary, your thoughts on sort of this economic collapse and how to put it in context vis-a-vis the balance with public health?
Absolutely. They're interdependent. You can't do one without the other. And every piece of data you read tells you that the better educated a person is, the better their health status is. It's really simple. And so in the context of then no jobs, not able to go to school, most of the people, the students we see, in fact, hold jobs in addition to going to school, right? So they've lost their jobs. Their families have lost their jobs. And I'm comfortable that we have the tools and we're building capacity so that we need to move forward on recovery. I don't see any reason to wait on it because we've got to get people just back to work, back outside, if you will, outside their bubbles for their mental health issues as well, which we're starting to see increase. So I was, delighted and have been to work with Ray and Mark on this because they clearly understand the big picture and the fact it takes lots of different sectors to really move us forward.
Yeah. I want to make sure to remind our viewers that you can ask questions as our conversation with our panelists continues throughout this lunch hour. You just find the QA tab on the right of our screen and you can type in questions and I'll be sure to try to get those posed to our folks. I want to move now to our second slide. This is a slide that Ray, you have contributed to the conversation. You got a lot going on here, but I think that's a relatively straightforward idea. Why don't you walk us through it?
Yeah, so this comes from the fundamental belief that it's actually a nice transition from the previous slide. It comes from the fundamental belief that it's time to begin reopening our economy and consider how we reopen to travel and tourism while taking sensible risk. And so what we try to do is help define what that sensible risk is. And so what this slide essentially shows us is there are three different curves based on the level of intervention or the level of screening that takes place as we begin to open up our airports and modify the impact on the statewide issued 14-day quarantine. And so the first curve is the blue curve, which essentially just has a questionnaire type screening. I think it's orange curve shows you have to forgive me if I'm wrong because I'm colorblind, but the next curve shows what happens when we introduce temperature checks, and the green curve represents what happens when we introduce testing prior to getting on an airplane to come to Hawaii from the mainland. And so this represents assuming that we have 10,000 visitors per day throughout the rest of the year. That's slightly higher than what UHERO is projecting at 7,000 to 8,000 visits. It uses the Johns Hopkins data, which would say that 33% of the infectious passengers are eliminated if you do thermal screening, and 80% if you move to pre-departure testing on top of the thermal screening and questionnaire. And so to me, this is a really good news story. This tells us that you see the top line up there, which shows that we have the capacity under any of these scenarios to manage within the existing resources within our statewide healthcare system. Now, this also requires some additional assumptions. It assumes that we execute well on a statewide plan that includes screening, testing, effective contact tracing, and have the ability to quarantine as appropriate. And it further assumes that we as a community continue to do the good work that we've done to allow us to flatten the curve through social distancing, through wearing masks as appropriate, and applying appropriate hand hygiene and general hygiene, and then just following good sense and staying home if we're sick. If all of these things come into play, we think that we more than have the capacity to safely begin inviting guests and visitors back into the state.
Mark, some people would say that the goal is of course zero new infections, 0 deaths. In reality, those are extraordinarily hard numbers to hit while you're while you're wading your way through a pandemic. How do we know where to kind of benchmark success? This is one that Ray's brought, staying underneath the total hospital capacity. That's an important one that saves lives. What are the other sort of benchmarks that you think about when it comes to how to wade through this time?
Yeah, I think the hospital capacity is one of the most important ones, but there's other components of the healthcare system that we can't overwhelm, whether it's primary care docs, our supply of personal protective equipment, whether it's our ability to test and contact trace. You're going to have cases. 0 cases is not only unrealistic, it's like frankly impossible. So you're going to have cases, and as you start to, as we talked about before, reopening the economy so you can get on with the task of not only living your life, but also protecting the public health of future generations, you're going to have cases. And the key is to be able to suppress them from spreading in an uncontrollable way. And the way you do that is you make sure you have the capacity to test people, to identify cases early, and to contact trace those people to make sure that they are contained where it doesn't spread widely in the community. And if you can do that, then you can have 20, 30 cases on a given day, but do it safely and do it in a way where the economy can open and people can live lives.
Yeah.
DJ, if I could just add one more point on this, is that this assumes on the worst case on the blue curve that at the peak we'd have 300 active cases, which would represent 40 to 50 per day.
Good, 40 to 50 per day. It's pretty modest. Pretty modest, frankly, looking at not just big places like New York that have been hit, but even states like Arizona that are in the 1,000 per day count right now. Let me ask any of you, because this is applicable to each of you, particularly Ray and Mark, but you spoke to this a moment ago, Mary. This question comes from Michelle Sigmund, who asks about this deferred care. And how concerning is that deferred care and the complications that result from it? How concerning is that in terms of a financial hit to commercial plans and ultimately to business premiums, if not this year, obviously, probably more appropriately next year and the next plan year? Anyone want to sort of take a crack, and Mary, maybe I'll look to you first, since you mentioned this a moment ago. How do we see this deferred care impacting the cost of care?
Well, I'm going to say a little bit and then turn it over to Mark, I think, but in terms of the deferred care, what we worry about is that all the strides of the last decade since the Obamacare ACA came in, where we really were shifting from all the resources going to acute care into prevention, right, and to primary care. We're concerned that we risk losing that. And then, so in the short term, there's impacts, but as you alluded to, in the long term, the impacts are much higher, both for individuals, for institutions, for insurers. So I'll defer to Mark because HMSA has been leading on a lot of this.
Yeah, and actually my slide, DJ, talks about that, and I can go into the economic consequences of the deferred care when I get to my slide. But I'll just say from a health standpoint, it's obviously deferred care is bad for health. As Mary mentioned, the things that people typically give up when they're deferring care are preventive things, like it's a vaccine, or it's an annual wellness visit, or it's the kind of things that keep you healthy and prevent you from getting disease at a later time. So if that isn't corrected relatively quickly, it impacts public health from a generational standpoint, and that's the thing we want to avoid happening.
Yeah, good. Let me ask maybe Ray, for you to think about this question. This is certainly a question that any of you can answer, but Gary May asks, how are you handling referrals when you're trying to get care, maybe to more complicated quaternary or other types of care? How are you handling referrals out to the mainland for complex services not available on the islands when you've got this kind of complicated COVID experience? Are things fundamentally different, or are they pretty much operating as per usual?
I think as far as referrals, I think they are opening up, or they're operating pretty much as usual, as long as our normal referral pathways are open. As you know, across the country, different states have opened up to different degrees. But thus far, we've created a graduated reopening process within our organization. We've been in conversations with Stanford University and others, where we refer a lot of patients when we need to, and they're doing similar. And so it's just through communication with the providers at the receiving organizations. And to my knowledge, we have not had any challenges to this date when those referrals were necessary.
Yeah, good. Why don't we jump into your slide here now, Mary, and we'll keep the conversation going. Walk us through what we've got on our screen here about a unified strategy.
Yeah, so in Hawaii, we would talk about a sail plan, right? Because we love our water analogies. But this is what we would think of as a unified strategy, a sail plan for how we get through this. And there are the, 4 pillars. Mark alluded to them, but each one is equally important. But we have challenges in each one as well. Surveillance, we talked about, this is a new novel virus. So we don't have a lot of history about where it's been. The Department of Health has been looking at their surveillance for flu and looking at COVID in the context of that and upskilling. We can look at syndromes, if you will, what kind of symptoms are we seeing? But we also are very concerned about what CDC calls congregate settings or high density settings. Those tend to be nursing homes, they could be dormitories, they could be factories. And how we understand that in the context of where the disease is and where it's going to move to. And then we have our vulnerable populations, people that have pre-existing health conditions. Maybe they just finished cancer chemotherapy and they're immunocompromised, or they have, metabolic syndrome, very common in Hawaii with diabetes. So trying to understand how the disease progresses both across the state and within some of those populations is going to be really important going forward to us. Testing, I'm going to jump through for the moment, and then I'll come back to it, because it tends to be where the most questions, the most concern, the most differences of opinion are, candidly. But once you've identified somebody as being infected through your testing, you really have to have rapid response. Some public health people would call it a strike team, but you've got to have contact tracers. You've got to have a way to stay in touch with the people who are both infected and identify who've been exposed. So we're actually working very closely with the Department of Health. We're in the middle of training contact tracers for them. By the end of this week, we'll have over 100 people trained. And by the end of July, it'll be over 300 people that will be there for the department to call on. Why this is so important is that if we get to see more than one case, or we start to see 10 cases a day reported, we just got to get out, get on top of those and get in front of them. Because that's really the key to containing it. We're looking at apps to do this. It's quite interesting. Department of Health is looking at one. Campuses, there are a million companies, if you will, putting apps in front of us. Younger generation obviously love their texts, and so a daily self-check. CDC is still recommending temperature taking, so we're all trying to figure out where that best works. And then the last and the most important is isolation and quarantine. So once you know someone is infected, you want to be sure you can get information to them and how they can access their care and when to access that care. Telehealth, this huge jump, Ray's organization has led a lot of it, but the idea that you don't run to the urgent care, but you really could do telehealth, access your provider. Our biggest challenges with that tend to be our visitor industry, right? And enforcement, which is just really tough. And we're getting certainly better at, but it's very tough for someone to come to Hawaii for 14 days and essentially be stuck in a hotel room, right? So we've got to figure out some better ways around some of that for people. But I don't know if any of you saw New Zealand the other day, thought they had it very well contained, and then they got 2 new cases. And there were essentially travelers who came in from England where they quarantined, but they gave them compassionate leave from quarantine to visit a dying relative, and then subsequently tested them, and both the two women were infected and are back in quarantine. So they've identified them and they're controlling it, and we've got to be thinking about that. Testing, I would say, is the most critical piece, and there are people that might disagree with me on this, but the PCR testing, which is our gold standard right now, we're looking at saliva testing, seems to be getting better. It's certainly easier on the person being tested, but also the person doing the testing. They don't need all the PPE equipment. Antibody testing, nobody seems too excited about it at this point. So the focus really until antibody testing gets better is really on getting testing out. But who do you test, right? You test people with symptoms, but do you think about proactive testing? CDC on Saturday, June 13th, actually came out with what they're calling consolidated testing recommendations that go further than they've gone previously. And so it's not only if you have symptoms, but it could be applied to people who've been exposed. It can be applied to people in congregate settings. And I think we're going to be looking in Hawaii, quite candidly, at how do we expand what we've been able to do. But we do have federal money for that. We're building lab capacity. We have about 10, labs that are doing this, as well as the state lab. But to sum it all up, you really need each one of those to be working for you if you're going to contain this. And I think that's where we've been so fortunate with our business community, with our insurers coming together, with our education organizations, working with our Department of Health and our governor's office. But we have to stay vigilant. We can't let our guard down on any one of those areas.
Yeah, a lot there. Thank you for walking us through all that, Mary. Let me ask you, Mark. Alyssa Nelson has a question that I think touches on this public health approach, but also our economic recovery. She asks, how can we center health equity in our recovery, since low-income workers are most likely to face the short and long-term effects of the pandemic, and Pacific Islanders are disproportionately impacted by COVID? I think there's a public health piece to that I think probably comes through in the testing conversation that Mary is talking about. who gets tested, who has access to tests. And then there's this economic recovery folks, and who might be getting more support based on demographics than others. How do you think about health equity when you wade into that conversation?
Yeah, health equity is obviously a challenge, like, always. I mean, I think we've all of us in healthcare have talked incessantly about how the social determinants of health have a much bigger impact on somebody's overall health than actual health care. Where you live, your economy, Mary mentioned, educational level, your income, all of those kinds of things are essential and probably most important in determining your ultimate health outcome. What COVID-19 probably did in any pandemic is it probably just puts an exclamation mark next to that and makes the need to address that and pay attention to it even more acute. That doesn't necessarily mean the answer is easier. It calls out the question better, but it's still a challenging thing to answer. So, I guess I'm not giving an answer except to say that it's a hard problem. It's something that we work on all the time. And I think Ray talked about it where he said, you call out that humanitarian piece most aggressively during this type of incident. So rather than being theoretical about social determinants of health, you actually have to just get out and do something about it, like address it, whether it's with, participating in a food drive or making sure that you actually create safe housing spaces for people who don't otherwise have it, to be quarantined, things like that. We just kind of have to do them.
Yeah. Ray, as a health system leader and not a health plan, let me pose this question to you about, in part, health plans. It comes from Lisa Allen, who asks about the role that government programs like MedQuest can play in not just public health, but in economic recovery. Obviously, MedQuest has taken a step forward and then a step back on a procurement for MedQuest. What if it were just you, me, and Judy Moore Peterson and a glass of wine? What would you say MedQuest ought to be doing right now to help support the public health response and the economic recovery?
Well, I think the most important piece is recognize that when you have this level of unemployment and the fact that this is likely going to be a sustained environment, we're going to have a larger group of the population likely move into the MedQuest population, and they need to be prepared to handle that influx of that population. We've seen what could happen when agencies aren't prepared to process and meet the needs of our community through what's happened in the unemployment situation. And frankly, that's not me being critical of the unemployment office because I don't think anybody could have anticipated or been prepared for the rate of flow that was coming into that office as quickly as it did. But as it relates to this, I think we have some awareness about what the future holds, that there will likely be some shift. And I think it's really important that the first and foremost that the state work closely with the health plans that will be providing some of those services to make sure that they work together to make a seamless process for the members in the community who have that need.
Yeah, and DJ, I would add to that as well that if they're able to make it easier for their enrollees through the plans or however they choose to do it, to access the preventive services, right? To get their mammograms and their colonoscopies and the things that we know are going to make a difference. Immunizations, for example, for children. Whatever potential or real barriers exist, we need them to be working much more closely with the Department of Health on some of this. They tend to function as separate organizations. And Judy knows me, and we've worked for years on school health issues. And some of the challenges that we're not using and we're not doing the uptake in our schools that we could be doing to get access, at least for children, for the K-12 populations of some of these services. So I think going back in and taking a good look at how they reimburse providers and how they help people get access to those services right now is even more critical than in regular times.
Hey, DJ, I just want to add one more quick thing if I could, and that's just credit to Mark. You've heard Mary and I both reference the vernacular of screening, testing, contact tracing, and quarantine or isolation, and that has become a common language throughout the state as it relates to how we work effectively within the virus, and that's largely because of the work that our public health task force did, public health recovery task force that Mark led, that Mary and I were a part of, has really made that impact. So kudos to Mark for pulling the community together under a common language.
Mark, with that, let me ask you to walk us through the slide that you've contributed to this conversation. Tell us what we should be looking for here in the slide that you've offered.
Sure. I thought this would just be interesting to the viewers and listeners today. This is kind of how, from a health plan perspective, we looked at the impacts to healthcare financing that would take place because of COVID-19, both from the revenue and expense side. So first I'll say that this is how we modeled it out. It's not what actually happened. And then after I go through the model, I'll just quickly say up to the point that we're at, like what actually happened. So if you look at the green line first, this is the revenue projection model. And what you see is that from baseline of 0, we expect obviously that initially the healthcare revenue would go down. And the reason for that is of unemployment that you saw in your initial thing, and more groups closing and shuttering their doors and not being able to contribute healthcare premiums on behalf of their employees. And so you see that going down. There's a second dip a little later as the federal subsidies, the PPP money, the Paycheck Protection Program money, starts running out for employers, and they can no longer support people on their employee rolls, and they have to change a furlough to a layoff, or just completely lay them off. So there's another dip, and that drives it down. And then as you start to have economic recovery and reopening, you see it start to come back up as people start to get reemployed and employers start being able to put people back on their payrolls. But it never gets back to baseline because there's a permanent shift of lower revenue due to a migration of people to Quest that will probably be permanent. And also the fact that, quite frankly, employers are going to demand lower healthcare plans because they just need, until the economy recovers, they need more affordable options, and they're not going to be able to buy a Cadillac plan, say, and so that revenue stream will be permanently, or not. When I say permanently, I mean over the course of 3 to 5 years, it will be suppressed from the previous baseline. The red line is the expense baseline, and the projections are that initially, as COVID hits, that goes down because the healthcare delivery system has to stop elective procedures and start deferring care in order to create capacity to take care of COVID. So you start to see this drop, and then you actually get the surge of COVID. So you have the spike in expense from people who are in ICU or sick. And as we escape that, it goes back down to the deferrals. And then as we recover, that starts to come back. And as deferred care comes back or a second surge, you might have another jump in expense from pent-up demand or a possible second wave. And then ultimately, when we get a vaccine or get down to where we're totally controlling that, it should come back to a baseline of expense. Now, what happened in Hawaii is interesting because we did a really good job of during the first surge of taking care of things like social distancing and staying at home and things like that. So we never had the massive surges that you saw in New York or New Jersey or any place like that. So we didn't have that big pandemic peak. So that big peak was not there. However, the deferral trough was also not as great just because most of the plans here in Hawaii, and for sure HMSA, I can speak for us, we didn't stop paying for things. For example, our payment transformation program that gives a global payment to primary care docs, they got that full amount even during this time. And we found other ways to help providers render care by paying for non-HIPAA compliant telehealth, for example, Skype and FaceTime and things like that, specialists could get paid for rendering that type of care. And so the trough wasn't as low and the peak wasn't as high, but the general kind of, I guess, flow of it is like that. So.
Yeah, good stuff. Let me ask you, is that sort of longer term reduction from baseline revenue? You mentioned that's in part because of a transition of folks to Quest. How much of your modeling takes into consideration people just leaving Hawaii and going to the mainland for economic opportunity?
Yes, I mean, that's another thing. I mean, I'm sure, I know Carl Bonham worries about that a lot, and the longer that we stay shut down, I think the more he predicts that will happen. So that definitely also will lower revenue for sure.
Yeah. Ray, does this, setting aside revenue versus expense, does this red line kind of track, or how closely does it track with what you perceive to be bed utilization in your hospitals?
I think it's I think hypothetically it's the right curve. I think we're finding that it's playing out slightly different. We certainly saw the large dip as we went to elective cases being put on the side for a while. And so, I mean, we saw our volumes decrease in excess of 70% while we weren't doing elective cases. We are beginning to get back to, I would say, on the outpatient side, 90+% of our pre-COVID-19 average volumes, not quite that high on the inpatient side or the surgical side, but that's largely because we are being very deliberate about how we reopen services. For instance, with all of our cases that require surgery, we're requiring a test within 72 hours prior to that surgical procedure. Further, we're being very deliberate about where those cases are performed, whether they're at our outpatient surgery centers or within our hospital ORs. And we're also being very deliberate about how we perform our outpatient clinic visits. Our expectation is that on a going forward basis, around 50% of our future visits will be continue to be virtual. Just last week, we saw 97% of our pre-COVID-19 average weekly volume within our clinic system, which is over 600 plus employed physicians, and 49% of those remain virtual visits. And so we're using this as an opportunity to very deliberately drive the strategies to a more value-based system as we look to the future of healthcare within Hawaii Pacific Health and hopefully within the state. And then lastly, we, as Mark suggested, we haven't seen the big surge. And so because of the increase in COVID-19 cases. And so that's where it differs from the red line here.
Yeah. I want to come back to this point about innovation that you raise, Ray. And of course, I still want to get to our fifth slide. But Mary, I want to ask your thoughts, your answer to this question raised by Michelle Sigmund. She asks, a key to reopening the economy will be with the reopening of schools for workers so that they can return to work. So any thoughts about what a safe return to school will look like?
Well, it depends on how much time you have, right? Because we have
a short elevator ride of one or 2 minutes.
So we're basically talking about 170,000 students across all our islands, right? One of the things DOE has done is our program, which provides school nurses and APRNs as well in the schools, pivoted very quickly to a hotline for parents that was linked up to telehealth visits. And we've seen a great uptake in that. But I know what you're talking about is more how are the buildings going to be ready? And there actually are criteria out there for us. CDC has given both for K-12 as well as higher ed. And there are things that we just have to look at. And these are large organizations. And I know that people within them are looking very carefully at it. We don't have all the answers yet. And I know people would love us to be able to be certain and say, this is what, high school's going to look like. This is what college is going to look like. But we're clearly looking at safety. We're looking at changing organization within our facilities. We're certainly doing a lot more online, which has pros and cons. And then the access to really screening and testing, I think it's going to be really important within the schools, because many of the public school students, close to 40–50% of them candidly, are MedQuest students. And so if they can get access in school, I think we're going to really see a difference. They won't be taking virus home to their kapuna or bringing it to us, because, but it's all a work in progress. We're all learning, but we're moving at the speed of light.
As a father of 3 school-age kids, I think it may be the case that what Michelle is asking for is an adult mental health program for our kids. For those of us with kids trying to distance learn.
Yes.
I want to look at our 5th slide here and point to a couple of data points. On the one hand, this is a collection of data points, and there's to sort of refer to Mark Twain, I think, who had the quote, "There are lies, damn lies, and then there are statistics," meaning it's very hard to know which statistics to look towards, whether it's the upward trend in Hawaii of new cases, but a very low absolute number. Hawaii has the lowest number of total cases per population. And while projections show Hawaii will be going up, cases will be increasing in September, October, at least according to the Institute for Health Metrics and Evaluation, it is far lower than the trend in the United States or a state like Arizona. So, Mark, what do you sort of look towards in terms of data points that you can kind of bet your business on, or bet the policy on, or how do you sort one data point from another when you're trying to think through this?
It is complicated, and that's why part of what we did with the public health recovery task force that all of us worked on was to try and create a matrix that people could simply look at to try and understand if we're in good shape. And the categories of those were the prevalence and severity of disease, which we tried to look at the number of cases or the trend in the median number of cases per day per week, as well as the number of hospitalized cases, because that gives you an indication of severity. And then how that balances against the healthcare capacity. So at what percentage of hospital beds and ICU beds and ventilators are we at? What percentage of testing are we using? And what percent of contact tracing are we occupying? And if you're green in all those categories, I think you can feel good as a business that we're not going to need to shut our economy back down, that we can continue moving along. And that's why I think it's important that we take a framework like that and kind of follow it and stick to it and use a common language so that people can understand how to move their life along. Because yes, you're right. If you look at all these numbers, it's really easy to get confused.
Super hard to make heads or tails of the data of the data here. Excuse me. Ray, let me ask this question from Emily Hain. She says, we've seen the acceleration and adoption of technologies like telehealth. You just commented on that experience in the HPH there, Ray. But what other areas do you foresee healthcare innovation or reform sort of being fast-tracked? What has been catalyzed as a result of COVID that might stick around after we get through this?
Yeah, I think obviously the biggest is virtual care, and that virtual care can come in a number of forms. It can be through telemedicine, it can be through virtual visits, it can be through using an exchange on our electronic medical record. But I think it also, for an organization our size, it includes work from home strategies that I think Mark talked about earlier. You know, we very early on in I think the third week of March, we had sent over 1,000 of our employees home to work from home. I suspect a good portion of those, their future will remain through a work at home environment, at least on a part-time basis, or at least with some discussion. For sure, I think making sure that we're providing care in the right location at the right time, based on the right needs, is going to be another component of that. But we've long believed within Hawaii Pacific Health that we needed to move from a fee-for-service, volume-based environment to a more value-based environment, which deploys many of the strategies that we've talked about during this time. And I think what we've seen is during this COVID-19 period, we've been, in a matter of weeks and maybe months, been able to advance those strategies that likely would have taken us years, both from a I think we're pretty well postured from a technology standpoint, but from a rapid deployment and decision-making and cultural acceptance within our organization and within our patient population has been moved forward and advanced for years as a result. And so I think the degree of success that we have to using this to transform ourselves into a more value-based environment will be based on the level of stickiness that we apply to those strategies that we've been able to deploy in short order. And so I see, that is the silver lining of what has been a tragic circumstance within our community and around the globe. But not to make light of it, but I can tell you within our organization, we have no intention of letting a pandemic go to waste. We have a real opportunity to make an impact for the future out of an unfortunate circumstance.
In the limited time we have left, I want to ask each of you just this one question, which is, and I'll start with you, Mary. If you were sitting down, and when you are sitting down with legislators and policymakers at the agency level and the governor himself, what counsel or advice would you give policymakers or other healthcare or executives as they try to get through what will probably be a much longer slog than we'd all like to admit?
Well, the recognition right now that it is going to be a longer slog. We're talking at least a couple of years. And when they look at making decisions, they need to have a longer lens. It's not about balancing your budget today. It's about what are you doing today that's going to impact everything from education to service to healthcare down the road. And that's critical. And that's a challenge. I know the legislators themselves and the governor worry about it. And it's tough to do with the unemployment rate and the pressures that are on them. But I think it's really critical for them that they stay the course on some of this. The state is a major employer in Hawaii. I think about 10% of people are employed in the state. So it's really critical to keep those employees at work and contributing and generating in terms of the economy, right? That's really important. So I would certainly say that's got to be a priority. And then not changing their investments in education. Education is an easy one to cut, again, because you can try to figure it out in the short term, but you have generational effects down the road on that. And so if the dollars don't come into the University of Hawaii, the only public system, 10 campuses across the state, we're going to see impacts on the neighbor islands, even more so on the people who've lost their jobs in the service industries, as well as on Oahu. It's just going to be really, really tough for people to move forward. And I think it will contribute to some of this exodus we all worry about.
Yeah, good stuff. Sad stuff, but good stuff. Ray, same question. What counsel or advice would you give to legislators, the governor, or other market executives, healthcare executives, when they think about how to navigate through this time?
Yeah, let me preface answering that question with telling you that answered a different question, which is how has our state performed? And I think that's important for people to hear. While we all have opinions and we all have provided feedback to the governor and the legislators and department heads and so forth, our state has performed extremely well. We've performed as well as any other state, if not any other country around the globe. And I think the results in terms of the number of cases we've had here in Hawaii, as well as the number of deaths we've had here in Hawaii, clearly speak volumes of the actions taken by our leaders, as well as the actions taken by our community in terms of compliance with what's been asked of them. And so it's easy to provide advice from the sidelines, which I do often, unfortunately. But that advice would be, I think we're at a point to where now we need a clearly communicated plan and path forward. I think it can be a relatively simple plan with 4 to 5 points about how we're going to go from where we're at to where we see ourselves recovering as a community in terms of reopening Hawaii to tourism, reopening education systems, support for businesses throughout the community, support for the population as it relates to those humanitarian issues that we've talked to before, and just a very succinct, well thought out plan that is communicated in a world-class way. I can tell you, having spoken to our leaders, they're doing that work. they have those plans either developed or being developed. I think all we need is to instill confidence in our community that there's a warm, dry tent over the island of Hawaii that is going to keep people safe and secure during what is a very scary time.
Mark, final thoughts. What counsel would you give our policymakers and other market leaders as they try to make it through these tough months and maybe tough years of COVID?
Yeah, I think I'm going to end up saying almost the same thing that both Mary and Ray said, just with my own words, which is basically that we're trying to thread this fine needle of, if you're going to get through COVID, we're going to need to develop public confidence in order for us to restore the economy. But that public confidence has to come along with public compliance with the safety measures that they will need to do to keep the disease at bay. So to do those two things in concert, you cannot emphasize enough the need to communicate. And after you've gotten tired of communicating, you communicate some more.
Yeah. Dr. Mark Mugiishi, President and CEO of HMSA, Ray Vara, President and CEO of Hawaii Pacific Health, and Dr. Mary Boland, Dean at the School of Nursing and Dental Hygiene at the University of Hawaii at Manoa. Thank you guys for being with us. 2 other points for those of you participating. We will have Lieutenant Governor Josh Green with us next Tuesday as part of our leadership series. So make sure you re-sign up and join us for that, number 1. And number 2, we'd really like to have your feedback on how we can continue to provide not just value in terms of content, but really high quality in terms of your interaction and experience with us. So we'll be sending you a feedback tool. I'd love to get your authentic and sincere thoughts on how we're doing. Thank you guys for watching this 5 slides we're discussing at State of Reform. We'll do it again in a few weeks. Take care.
Thanks for joining us in this virtual conversation and for your support of our work at State of Reform.